Okay, hello everybody. Welcome to Daily with Doc. My name is Becca Dukes, and today is Friday, Pharmacist Fridays with Pharmacist Ben Fuchs. So we are excited to have you here with us, as today is going to be question and answer day. If you have questions for Pharmacist Ben, make sure that you pop into the Zoom room with us live. Just simply go to dailywithdoclive.com. That's dailywithdoclive.com. You are welcome to come into the Zoom room with us right now or Fridays from 12 to 1 p.m. Pacific time. So if you're out on any of the places that we stream, welcome. And for many of them, if you have a way to do comments, we do have people on our team that are watching for those comments so that we can get those questions answered, but that is not a guarantee. But if you come into the room with us, you have a better opportunity to have your questions answered. And I want to do a shout out, as today is our first day to be able to live stream to Twitter on our Critical Health News channel. So folks, if you are a Twitter viewer, a Rumble viewer, a YouTube viewer, any of the podcasts, actually, Spotify, Amazon Music, or even watching us on TV, Roku, Apple, and Fire TV, we just want to make sure that you are invited and encouraged to like and follow us and share. And you can get some thank you options for sharing from me for those with the most points on dwdgiveaway.com. I will be sending out thank you notes and thank you gifts for those who share. So without further ado, it is my honor to present to you this program sponsored by DailywithDoc.com, where we are a group of individuals who just have a passion for health, wellness, and people. And one of our great leaders who has joined us in really creating an environment that we can thrive in is Pharmacist Ben Fuchs. Now, for those of you who do not know Pharmacist Ben, he is a pharmacist. He's a compound pharmacist. He has been educated in the whole world of pharmacy, which really takes a deeper dive into the nutrition aspect as well and how nutrients work within the body. And he brings it together with more than just the pharmaceutical side of it, what we put in our mouths for pharmaceuticals, or even skincare and what we put on our skin, because everything the body has the opportunity to use in a beneficial way or not quite so much. So, Pharmacist Ben Fuchs, welcome to Pharmacist Fridays with you and I.
Thank you. Thank you, Rebecca. Great to see everybody. I see Doc there too. Hi, Doc. Good to see
Yep.
you. Yeah, so we're going to take questions here because we always run short on time. Hi, Jill. We always run short on time. So I thought we would just do all questions. But before we do that, I want to just real touch on one thing real quickly, and then we'll jump into questions. And that is the idea of the first principle in medicine. Well, first of all, a first principle is an assumption that's made and everything follows from that in science. First principle, for example, we say all disease is cell disease. That's a first principle. Everything follows from the concept of all disease is cell disease. In medicine, a first principle is first do no harm, and that's part of the Hippocratic Oath that doctors have to say when they get licensed or when they graduate. And the problem is while we give lip service to first do no harm, all of our medical protocols and interventions do harm. That's exactly what they do. So we have an alternative. We have an option. And that is an intervention that not only follows the Hippocratic Oath of do no harm, or the Hippocratic slogan of do no harm, but it's also a resolution of a fundamental cause of disease, of bodily breakdown. And that's something that Dr. Wallach has been talking about for decades. And Doc saw it firsthand as a if I can presume, Doc, I don't mean to be presumptuous here, but he saw it as a farm boy. He saw how vets were treating animals, and he just made the intuitive leap that the same thing could be done with human beings, and that is using nutrition where other healthcare practitioners use toxic pharmaceutical drugs. Not only are nutrients kind and gentle to the body, not only do nutrients get used by the body, and keep in mind, drugs don't get used by the body, they have to be detoxified by the body. But in addition to all that, at the end of the day, nutritional deficiencies are usually at the core of the disease process. Even at the point of death, cells die because they're not getting fed. So not only do we have a non-toxic intervention available to us that is allows us to follow the Hippocratic slogan of do no harm, not only do these nutritional interventions actually get used by the body as opposed to having to be detoxified by the body, they get incorporated into the body, into various biochemical processes and the structural components of the body. But at the end of the day, we suffer from nutritional deficiencies, and nutrients can obviously address that. So we have an intervention available to us that's non-toxic, that gets used by the body, and that really does solve the problem at the fundamental level of its cause. But nutrition can be very confusing. People don't know, what supplement do I take? How do I take my supplements? What form of supplements do I take? How often do I take them? How much do I take? There's so many issues that are involved in utilizing nutrition, and the average person has nowhere to turn because our health authorities don't know. The people who we trust to take care of our health are completely oblivious to this strategy, and really it's not their fault. They're not trained in how to take care, how to address causes and how to reverse diseases. They're trained in how to reduce symptoms. This is what doctors do. So it's, we make fun of them, we tease them a little bit. Sometimes we do more than tease them when we say, oh, they only get one semester of nutrition. They don't really understand nutrition. People go to the hospital and they get taken off all their nutritional supplements so their drugs will work correctly. I mean, these ridiculous things that people who understand nutrition look at and say, this is craziness. But the fact is, that's not what a doctor is supposed to do. A doctor is supposed to just relieve symptoms and stitch the body up when there's an emergency. When it comes to addressing causes of disease, we have to address lifestyle issues. And at the front of the line of lifestyle modification is nutritional supplementation. It is confusing. Our health authorities, our opinion leaders, the people who we trust to give us information don't know. That's why we here are so important. That's why Doc is doing the Lord's work. And that's why all of us here who are participating in this program and helping share and spread the word are so valuable to the culture and to the world. Because we have simplified nutrition. And you guys are always saying, oh, Ben simplifies things and makes it easy to understand. We can all do that. And the way we do that in terms of information is through meetings like this that we have on a regular basis. And we make ourselves available. All the healthcare professionals, as well as the health coaches, make themselves available to consumers. But we also have wonderful products that simplify the process. Got diabetes? How do you know? Do I take chromium? Do I take niacin? Do I take selenium? How do I take them? Don't worry about it. We've got the healthy blood sugar pack. I have my grandfather, my mother's got dementia. What do I do? Do I take niacin, the B vitamins, electrolytes? What do I do? It doesn't matter. We got the healthy brain and heart pack. If you have cardiovascular disease, we got the healthy brain and heart pack. If you got bone problems, we got the healthy bone and joint pack. We have got systems and products in place that simplify the entire process, so that not only do we provide solutions, but we provide solutions in a simple way. In a world where everything is so confusing, we're like a beacon of light in the darkness to help not only spread the word about the potential of nutritional supplementation to reverse chronic degenerative diseases and increase longevity and improve quality of life, but to provide the products that are simple and easy to use, inexpensive, and most importantly, incredibly effective, as anybody who's used or as anybody who's recommended the longevity packs or the longevity products that people can testify to. So we want to appreciate ourselves, everybody here, we got to appreciate ourselves as being valuable members of the culture and the community who are providing an incredibly important service that nobody else is providing. Nobody else is providing. Even if you have chiropractors and alternative practitioners who are talking about this kind of stuff, nobody has the simple products and protocols and systems that we have at Youngevity. And of course, we all want to make money, and there's a wonderful business opportunity to be had along with along with this very laudable goal of helping improve people's lives at the most fundamental level, which is the level of health and nutrition. So I want everybody here to understand that we're very important. We provide a very valuable service, and don't underestimate how smart you are when it comes to nutrition. Just by virtue of being on these calls, just by virtue of being on one call, we're at the tip of the spear. You know, sometimes we forget because we're all hanging out with people who nutritionally supplement, who understand the power of nutrition, but 95, maybe 99% of Americans still don't know about the power of nutrition. They still don't know that there are nutritional non-toxic alternatives to their beta blockers and calcium channel blockers and antihypertensives and all the medicine that they're taking that are completely non-toxic and can really solve the problem. Most people don't know it. Those most people are our customers, potential customers. We have an ocean of potential business out there, an ocean of potential business that not only represents money in our pockets and a way that we can make a nice living, but an ocean of potential customers that whose lives we can improve dramatically. And I tell you this as somebody who gets the letters, and you wouldn't believe the letters that I get. You wouldn't believe the phone calls that I get, the horrors that people are going through in terms of not only their health, but in terms of their solutions. It's not just their health that is deteriorating, but the solutions, the surgeries and the drugs and the ablations and the medical protocols are further exacerbating the problem. They're destroying people's health on top of the disease states that they're going to the healthcare professionals for. So as it says in the Bible, my people perish for lack of knowledge. Not only are we here to solve that problem by providing knowledge, we also can provide wonderful products. And everybody who's on this call, distributors who are on this call, and even people who are just on this call to learn more, understand that we are a potential part of an incredible solution that can change the world at the most basic level there is, which is the level of good health and nutrition. And with that, I will close and take questions.
All right, and that's kind of an introduction, folks, and I'm going to give the official invitation for all of you who have ever thought about getting into health and nutrition and joining us on this crusade, because we are a vital part of what's missing in the information that is out there. And we invite you to be part of the solution. So we are going to be having a Zoom immediately following this one that you will be welcome to join us in as well. So, Pharmacist Ben.
Yes, ma'am.
One of the first questions that has come up, and you had mentioned it, so it's perfect. Products, how to take, when to take. And the specific one that is being asked about is the Flora FX. Now, Flora FX is a product by Youngevity. It's a proprietary blend of pre and probiotics that's formulated to support the digestive function and optimal nutrient absorption and metabolism. The question is, when is the best time to take this?
You know, it's not that cut and dry. Some people will get benefits when they take it with food. Some people take benefits without taking with food. But the question of when you take a supplement for most people is not as relevant as taking the supplement. If you want to fine tune everything and you're getting all your mighty 90 essential nutrients and you're perfectly healthy, there's probably some supplements you want to take with food and some that you don't. For the most part, supplements are the active ingredients in food. So you want your digestive system primed to digest. You want digestive juices flowing. You want the enzymes working. You want all of the fluids and machinery that are responsible for the digestive process, digestion and assimilation, to be kicking in when you take your supplements, which to the body, functionally anyway, are like foods. They're the active ingredients in foods. So it's always a good idea to take if you want to just pick one time, it's always a good idea to take your supplements with food. As far as the Flora FX goes, probably doesn't matter. There are some bacteria that are a little bit more fragile, and they could be susceptible to damage by stomach acid. I'm not sure of the bacteria in Flora FX, but certainly Acidophilus, which is an acid bacteria, Lactobacillus acidophilus, can handle acid. Some can't. I'm not really on the Flora FX. I'm not really sure of the spectrum, the various spectrum of bacteria. So I'd have to be definitive. Can't really answer that right now. But as a general rule, you want to take your supplements with food. As far as the probiotics go, I would have to look at some of these bacteria and see which ones are more fragile. I don't know, maybe Doc knows which ones are more fragile that you want to take on an empty stomach. But for the most part, supplements should be taken with food. Doc, do you have anything to say about the Flora FX?
Hold on, Doc. There you go.
Okay. Yeah, I like to take the probiotics with food because they're happy in the food environment and your body's happy with the food environment. So it's a good mix.
I would agree with that.
All right. From the man himself, Dr. Joel Wallach.
Thank you, Doc.
Oh, thank you.
Yeah. Thank you, Doc. And for those that don't know Dr. Wallach is started out as a young man that had some issues. He was directed to look more into nutrition, which then helped him with his issues. He started helping others at his young age, which then took him into studying for Bachelor of Science in Agriculture with plants and soil, and then going into Doctor of Veterinary Medicine, where he has found a lot of information about things that are what used to be or what thought to be human genetic conditions. And Dr. Wallach is actually one of the founding fathers of the science of epigenetics that has proven the theory of disease transmission through genetics to be incorrect. So thank you, Dr. Wallach, for all that you do. And he also has 3 postdoctorates in pathology with almost 30,000 autopsies under his belt of all different types of species. I think it's over 452. And he is a doctor of naturopathic medicine. So, and the founder of the company.
And a prolific writer and author. And we don't talk about this enough, but he has got, if you guys want, I'm a reader. That's one of my favorite things to do is to read. And Doc is an incredible author who brings in history and sociology and archaeology and anthropology and nutrition and veterinary medicine. And I tell Doc, he's a polymath is what I call Doc, because he's got all of these different skill sets, and his books blend everything together in this really entertaining and compelling way, and not to mention informative. Hell's Kitchen is an awesome book, Rare Earths, Forbidden Cures, but my favorite is Epigenetics. As a history buff myself, it traces historical advances throughout history, culminating in his discovery and his observation of the epi nature of genetics. The epi nature of genetics refers to the regulatory nature of genes. You know, you hear people say, oh, it's in your genes. Oh, my mother had it, so I'm going to have diabetes, or my father had autoimmunity, so I'm going to have autoimmunity. By understanding epigenetics, you know that this central dogma is not necessarily correct. By the way, a dogma refers to a religious concept that is taken on faith, not on science. That's a definition of a dogma. And the idea of the central dogma that everything comes from genes, the whole idea that that the genes are our destiny, whatever our genes are, is a fallacy. And anybody who even understands anything about genetics recognizes that that's a fallacy. Unfortunately, our medical professionals sometimes don't recognize genetic or scientific truths. And so we get this idea that it's all based on genetics, when in fact the regulatory factors that control genes are transcendent to the genes. You know, every cell in the body has all of the genetic material for making the entire body. So your eye cell has all the genetic material for making a bone cell and a skin cell and a heart cell and a liver cell, but it doesn't. It just makes an eye. Why does it just make an eye? Because only the genes that make the eye are turned on in the eye cell. Just like only the genes that make the skin are turned on in the skin cell, and only the genes that make the bone are turned on the bone cell. Why is that? Because there are factors in place that turn certain genes on and turn certain genes off. So eye DNA only makes eye cells, and bone DNA only makes bone cells. So all you got to do is understand how genes work to understand that the genes have to have a control factor that determines which ones are going to turn on and off. Those control factors are known as epi, meaning above, genetic factors. And many of these epigenetic factors are, surprise, surprise, nutritional. Vitamins and minerals are, and even amino acids control which genes are going to be turned on and off. And that's why sometimes people give Doc a hard time when he says Doc says some shocking things sometimes to get attention. Sometimes he goes, there's no such thing as a genetic disease. And people go, oh my God, what are you talking about? And what he means is that even in the womb, the DNA, the genes require nutrition so that the genetic material can be healthy. So obviously genes control things, but there are things that control the genes, and that's where we have power. And the medical model doesn't want that power taken away from them, because right now they have the power, but we should know we have the power through just good quality living. In fact, not only are there nutritional supplements that are epigenetic, but even the thoughts we think and the feelings we feel control our genes. So via our lifestyle, what we put in our mouth, nutritional supplementation, how we think, how we emote, all of these are powerful ways that we can control our genetics and our genetic destiny. And of course, the book Epigenetics describes that. So if anybody wants some good reading and really easy reading and very entertaining reading, get Epigenetics. See, Doc's got a lot of books, but that's my favorite, Epigenetics.
Epigenetics is mine as well. In fact, that was my book of hope, because I'm glad that you brought up the whole emotion, mental side of it as well, because so many people are given a diagnosis and they become that diagnosis.
Yeah. That's right.
They're told it's genetic. There's nothing they can do except for control symptoms.
Yeah, that's right. And you're going to be on this drug the rest of your life.
Yeah. And I'm living proof that that's incorrect.
That's right.
And it's because I followed Dr. Wallach, his teaching, his recommendations. And that's what gives me the passion that I have to be able to do this show and share the message with others. And just as we work together, we're building a healthier world, right? That's my thought.
Thank you.
Yeah, so I'm really glad that you brought that up. And then you were talking about the cells, the cells of the bone, cells of the eyes. And Ron has a question in regards to eye health. He wants to know what he can do to improve his eye health, allowing him to read with both eyes.
Well, the eyes are subject to a lot of damage, or subject to a lot of stress, we'll say, not want to say damage, subject to a lot of stress because they're exposed to the light. The light's very powerful. So if you have a metabolic issue, a biochemical issue where your body's deteriorating, a lot of times it's going to show up in the eyes first, or it will show up in the eyes anyway, because the eyes are so fragile and so susceptible to damage from the light. So the most important thing, aside from the Healthy Star Pack, which, and we're going to give a lot of supplements here, but the Healthy Star Pack is the core of everything. We've got two really cool products for the eyes. One is called Vision FX, and the other is called Occutive. I love the Occutive, so I would be doing both of those. One of the biggest problems associated with eye health is blood sugar issues and diabetes or dysglycemia. I prefer to say dysglycemia, and I don't want people to be thrown off by that term instead of diabetes. Diabetes is an official diagnosis that's based on a certain number. And this is how diagnoses occur. They're based on metrics. So if your blood sugar is at 119.999999999, you're good. But if it goes to 120, you're diabetic. And that's the arbitrary nature of diagnoses. On the other hand, dysglycemia is a generic term that just means your blood sugar is messed up. You're not handling sugar correctly. Your insulin is not working to pull sugar out of the blood. Your blood sugar stays high. So I prefer to use the term dysglycemia to diabetes. So basically, I don't want people to be thrown off by that term, but it just means messed up blood sugar. Dys for dysfunctional, glyce for sugar, emia for blood, messed up blood sugar, dysglycemia. So the eyes are very susceptible to damage from elevated blood sugar. Insulin resistance, or as they say, metabolic syndrome, is a condition where the cells don't listen to insulin. Insulin secretion occurs so chronically that eventually the cells tune out, basically. They stop listening to insulin, so they become resistant to its signals to pull sugar out of the blood. The sugar stays high. There are very tiny blood vessels in the eyes, and those tiny blood vessels are susceptible to damage from sugar. And this is why dysglycemia is a leading cause of blindness. It's a leading cause of macular degeneration, and it's a leading cause of glaucoma. So, and it's also a leading cause of amputations, by the way, because there's also blood vessels in the extremities, in the fingers and the toes. There's very tiny capillaries, as well as in the kidneys. And so kidney issues, numbness of the fingers and toes, or peripheral, they call it peripheral neuropathy, burning pain. Doc's holding something up there. What is that?
He is holding up the I-26.
Oh, yes, that's great. Let's talk about the I-26 here in a sec. I-26 is an amazing product, by the way, and one that doesn't get anywhere near the publicity that it should, or the promotion that it should. We'll talk about that here in a sec. So working on blood sugar is also important. A healthy blood sugar pack for the gentleman who's worried about his eyes. I-26 is an absolutely fascinating supplement, and we've talked about that. I think I've talked about it about a month ago, but just real quickly, one of the reasons why our health declines, and you guys have all heard me talk about the triangle of disease, the 3 points of bodily breakdown that underlie all chronic health challenges. And these 3 points of bodily breakdown break down sequentially and developmentally. And when we're very, very young, sometimes in the womb, but certainly within months to years to a year or two after we leave the womb, for most Americans, we start dealing with digestive health issues. That has to do with the kind of foods babies are fed. That has to do with breast milk or the lack of breast milk. And that has to do with cesarean sections. For a whole bunch of reasons, our digestive system becomes compromised at a young age. When the digestive system becomes compromised, the bacterial profile, the so-called microbiome in the intestine can become compromised and the wrong bacteria can grow. This condition is technically referred to as small intestinal bacterial overgrowth. And it is the reason the intestine is the first point on the triangle of disease. Once those bacteria start to hyperproliferate in the small intestine, you're not supposed to have a lot of bacteria in the small intestine. Most of the bacteria in the microbiome are in the large intestine. The reason you don't want to have a lot of bacteria in the small intestine is because that's where food is. So if you have a lot of bacteria in the small intestine, it's going to be very easy for them to hyperproliferate, creating inflammatory responses and throwing off the bacterial balance. When that occurs, inflammation can occur in the intestinal lining. Once inflammation occurs in the intestinal lining, things can leak through into the blood without being vetted. The material has to go from the blood into the intestine in a sort of controlled fashion. Can't have things just running into the blood willy-nilly. So there are kind of like border guards, cells that vet various molecules before they get into the intestine. However, if there's inflammation in the intestine following these bacterial problems, which itself follow the wrong kinds of foods and nutritional deficiencies, things can leak into the blood. And when I say things can leak into the blood, I'm talking about bacteria can leak in the blood, pieces of bacteria and toxins from bacteria can leak into the blood, food particles can leak out into the blood, bacterial outgassings and secretions can leak out into the blood. A very, very bad thing. In Leviticus, we learn in the Bible, the life of the body is in the blood. The blood is the sacred space. Nothing is supposed to get into the blood that is not supposed to somehow serve the body. But through this phenomenon, which by the way is called leaky gut or leaky gut syndrome, all health challenges ensue. And by the way, Doc has been talking about this for decades, and I'm sure everybody knows about this. Gluten can be a big problem. This is where gluten wreaks havoc on the body by creating inflammation at the level of the intestine. But there's other things too. It's not just gluten, but gluten is that's the big one. And that's why grains and cereals are so problematic. Breads and cereals and such are so problematic. In any case, once things leak out into the blood, you get immune reactions in the bloodstream. And those immune reactions can be measured. And doctors will actually measure them as circulating immune complexes or CICs. And CICs are a measurement of how much immune activity is going on in the blood. So people have autoimmune problems or people who have any kind of immune issues, people have hypothyroidism, all of these chronic inflammation, fibromyalgia, all of these can be the end result of this leaky gut phenomena, which means killing those excess bacteria in the intestine is incredibly important. Well, you go to a doctor, usually they won't even know about this condition of small intestinal bacterial overgrowth, but if they do and they're a little bit younger, they're a little bit more hip to this, they'll give you an antibiotic, right? Well, we all know about the problems associated with antibiotics. Thus, the importance of this wonderful nutritional dietary supplement called I-26. I-26 is subtitled Hyperimmune Egg. And the reason it's called Hyperimmune Egg is because it is derived from eggs that are laid by chickens that have been induced to create antibodies via injection. They inject the hens, and then antibody with antigens, and antibodies come out in the eggs. They dry out the eggs, and that's what I-26 powder is. It's dried eggs with an antibiotic property. a gentle antibiotic property that kills the bacteria in the intestine, the overgrowing bacteria in the small intestine, to help resolve this leaky gut condition. And via resolution of leaky gut, autoimmune symptoms can subside, general inflammatory symptoms can subside. We're talking about the eyes. If you have eye issues, sometimes those can subside. Allergies, seasonal allergies can be the result of this leaky gut issue. And I-26 is a great product to get to folks who have hay fever or seasonal allergy issues. Food allergy issues can be resolved with I-26. Any kind of hyperimmune activity can be resolved by using hyperimmune A. And that includes especially autoimmunity, which to a medical professional has no known cause and no known cure. But everybody who has autoimmune issues should be on I-26. In addition, everybody has digestive issues. And in fact, I-26 is just a great supplement to take for anybody. Even if you're healthy, it's a great supplement to take.
So how about those that have a sensitivity or an allergy to eggs?
Yeah, if you have sensitivity or allergy to eggs, you want to kind of pay attention to that because they are eggs. But I will say that a lot of times food allergies, including egg allergies, can be resolved by resolving SIBO, small intestinal bacterial overgrowth. So a lot of people who think they have food allergies may actually be hypersensitive because of the small intestinal bacterial overgrowth condition. And by resolving that, they may find that all of a sudden they can eat eggs, or they can eat oranges, or they can do dairy, whatever it is that they're having problems with.
Mm-hmm. All right. And there's a question, and you had mentioned all of these different things that go on with the gut, with the leaky gut, and how it affects so many different parts of the body. Somebody is wanting to know, what do I do if I've tried everything and I can't lose weight?
Okay, well, that's a great question, but never, ever, ever, in the interests of getting better, never say I've tried everything. Because immediately you cut everything off. You cut off your solutions. You say, what I've tried hasn't worked, but you haven't tried everything. That's first of all. So that's just a psychological strategy that you want to employ if you're frustrated by all the things by doing a lot of things and nothing's working. Never say I've tried everything. Secondly, weight loss is a very interesting subject, and there's a lot of reasons why people will gain weight. But the first thing you want to think about is lowering your blood sugar and sensitizing your insulin. And there's a couple other things you're going to want to do too, but the first thing is going to be to lower blood sugar, or stabilize blood sugar, and strengthen insulin. And that's where your healthy blood sugar pack comes in.
Right.
So that's the first thing. But there's also other things too. And in the healthy blood sugar pack, you'll find maybe my favorite non-proprietary supplement, longevity supplement, which is the ultimate EFAs. And we should spend maybe a whole hour talking about how important the ultimate EFAs are. But the ultimate EFAs help normalize the body's weight gain, the body's second weight gain hormone. The body's first weight gain hormone is insulin, but the second weight gain hormone is estrogen. And the ultimate EFAs, the essential fatty acids, and the ultimate EFAs help normalize estrogen. Now, estrogen is a very fascinating hormone in the sense that it is the body's most powerful steroid hormone. When I was compounding, I used to have to compound estrogen creams in my pharmacy, and we would have to be so careful because if we were off by a milligram, patients would come back with bloating and weight gain and depression and problems sleeping because estrogen wreaks havoc on the body because it is a growth and stress substance. So it makes things grow and it activates the stress response. So for people who are not clearing out estrogen, I'll talk about that here in a second, not clearing out estrogen effectively, anxiety and sleeplessness and jitteriness and breast pain and inflammation and autoimmune issues, all of these can, I think I said weight gain, but if I didn't, weight gain, all of these can ensue following problems with estrogen. So what goes wrong with estrogen? Estrogen is extremely, extremely powerful, and the body has to eliminate it quickly. Unfortunately, the body eliminates estrogen in 2 steps. And if the second step is not proceeding effectively, toxic estrogen can build up. And estrogen is already very powerful, but this intermediary form of estrogen is even more powerful. Technically, it's called, these molecules are called catechol estrogens, and they're extremely, extremely dangerous. So for folks who are dealing with autoimmunity or endometriosis or fibromyalgia or infertility or reproductive problems or weight gain issues or anxiety issues, and by folks, I mean women. And by the way, most autoimmune patients are women. Most hypothyroid patients are women. Most depressed patients are women. And it's not just because they have to live with men. It's because of their hormones, specifically their estrogen. And so estrogen is associated with all kinds of health problems, and eliminating estrogen is incredibly important. If you find that you're not gaining weight or not losing weight, and you've been diagnosed with hypothyroidism, that is a classic sign of elevated catechoestrogens or problems metabolizing and clearing estrogen. Estrogen is cleared out through the bowels. And ironically, when your estrogen is high, that can suppress the thyroid, which can cause constipation, which can make your estrogen higher and suppress the thyroid even further, and you get this vicious downward spiral. So encouraging healthy bowel movements is very important for people, for women who have problems gaining weight, and especially if they're their weight issues are following problems with their menstrual cycles or problems with their reproductive system or breast pain or endometriosis or cervical or ovarian issues. All of this in conjunction with weight gain issues are a clarion call for problems with estrogen. So using OsteoMag, the Rainforest product, all of these are great ways to help, and the I-26, all these are great ways to improve bowel movements. The Ultimate Microbiome is also a great way to improve bowel movements. And then the Nightly Essence and the FlorFX, for that matter, can help stabilize bacteria. When you have excessive bacteria in the intestine via the SIBO condition that we talked about, that can, believe it or not, activate estrogen. There are bacteria that can activate estrogen in the intestine and making it even more potent. So using the I-26 as well as the FlorFX and the Nightly Essence, which I've loved for a long time. Now, another cause of SIBO, small intestinal bacterial overgrowth, that we didn't talk about is deficiencies in stomach acid and in bile. Both stomach acid and bile kill bacteria. They're antibacterial. So using your ultimate enzymes, which not only contain digestive enzymes for helping you digest your food, but also contain a hidden gem of a active ingredient, and that's betaine HCl. And I say betaine HCl is a hidden gem because it's got a lot of benefits. In addition to the fact that it's hydrochloric acid, HCl means hydrochloric acid, and that will help acidify the contents of the stomach. Betaine is also a very valuable supplement on its own as a methylating agent. It helps for folks who are dealing with MTHFR issues. Betaine is also a source of one of the most important amino acids in the body for building connective tissue and also for helping detoxify estrogen, and that's glycine. You don't hear a lot about glycine, but it's a really, really valuable amino acid for detox, as well as for the connective tissue and the joints and for preventing wrinkles, etc. So ultimate enzymes for helping with small intestinal bacterial overgrowth. And another ingredient in the ultimate enzymes, which is also very important, undervalued or underleveraged dietary supplement, is bile, B-I-L-E, bile. Bile is not only antibacterial, but it also, obviously, most folks know, it helps support the digestive process, the fat digestive process, fat digestion. Bile is also an antioxidant. And if you have liver problems, or God forbid, if they've taken your gallbladder out, and 500,000 gallbladders are removed out of people's bodies every year, the bile can help support a fat metabolism and fat digestion and fat metabolism for folks who are dealing with gallbladder issues. And by the way, if you have your gallbladder, keep it. But Doc and I call the ultimate enzymes gallbladder in a bottle, right, Doc? I like that gallbladder in a bottle. So if you don't have your gallbladder, the ultimate enzymes can really help. And also if you're dealing with this SIBO condition, and this is all to answer the question for the person who says she's having, I assume it was a lady, but maybe it was a guy having problem. It was a man. Okay, having problems losing weight. And by the way, we talk about estrogen as being a female hormone, but men make estrogen too. It's not only women. Women obviously make more of it, but men also make estrogen. So the two most important hormones that are involved in weight gain are going to be insulin and estrogen for males, or men or women. Now, sometimes you'll hear people talking about the thyroid, and that is true, that low thyroid function, which is usually caused by an autoimmune disease called Hashimoto's disease, that can also cause weight gain issues, but it's very difficult to work on the thyroid by itself because it's so responsive to the other 3 points on the triangle of disease: the adrenal glands, the blood sugar system, and the digestive system. So the best way to work on the thyroid, and hypothyroidism being a cause of weight gain, is to work on the adrenal health, stress hormone, cortisol, especially, as well as reproductive hormones, female reproductive hormones, and blood sugar. And it probably would not be a bad idea to use the I-26 and the FluorFX or the Nightly Essence and the Ultimate Microbiome and all. There's so many wonderful digestive supplements that Youngevity has. And I love talking about the digestive system, and I know a lot about it, but we got a gal who's a Youngevity distributor, who's been a Youngevity distributor for not almost as long as I have, I think for 25 years or so. And that's Dr. Joanne Conway. She's a nurse, and now she's a naturopathic physician, and she's actually literally wrote the book, on digestive health. And I don't remember the name of the book, but it's a very easy to read book. And you have it there, Rebecca? There you go. Why America is Sick. That's right. That's right. And so if anybody has questions about the digestive system or issues that way, I'm happy to answer. But Dr. Conway knows, she's forgotten more than I'll ever know about digestive health.
And we are going to be having Dr. Conway on talking about the gut-brain connection, folks. Huge, huge topic that is overlooked or just not known about is the connection between what's going on with the digestive system and how it actually affects our mental, emotional health and the brain. So yeah, that was actually, you just worked right into the next question. I think you already answered the next question as well, which has to do what happens if you have sudden onset of heartburn.
Oh, same.
Same
Heartburn
thing.
Heartburn is a reflux, I assume you're talking about. And I haven't had it a lot, but I've had it enough times, 2 or 3 times in my life, that I can, man, holy cow. You ever have that, Rebecca? You wake up in the middle of the night and, oh my God, that's a classic digestive issue and a food issue. And
yeah.
I found the few times I've had it, I've eaten the wrong foods before I went to bed, and I'll never do that again, or eating too much foods. But that, believe it or not, is not an acid issue, even though you can taste the acid, and that's why it seems like it's an acid issue. And obviously, the medical model believes it's an acid issue because the main drugs they give you are acid suppressants for treating heartburn, or GERD, more technically, gastroesophageal reflux disease. And chronic GERD is a very serious problem. It can lead to what is one of the worst cancers a human being can ever have to endure, which is called Barrett's esophagus or esophageal cancer. And it's awful. That's god awful, and nobody ever wants that to happen. So it should be taken very seriously, number one. It should be regarded as a digestive issue, number two, not a too much acid issue, even though there are people swallowing Pepcid and Nexium and Prilosec like they're Skittles in order to suppress that acid. Now, of course, we know that acid is super important for digestion. And we just said how acid is antibacterial. It will kill the bacteria that can overgrow in the small intestine. If you're taking Nexium and Prilosec and Pepcid and acid suppressants, obviously you're going to run a problem with excess bacteria, because now you've suppressed one of the main antibacterial secretions that your body makes, which is hydrochloric acid. Now, it's hard to say that to somebody, because once they take Pepcid or Nexium or whatever it is they're taking, they don't have any more GERD because they're not making acids. They'll be like, "What the heck? I'm not stopping this because it's keeping me from having this reflux issue." However, it's costing you, and it's especially costing you long term. Not only short term for the SIBO issue, but you need acid to absorb nutrients. You need acid to break up protein. Without enough acid, you can't break up proteins completely. And that means incomplete fragments of protein will get into the intestine and ultimately can leak into the blood, leading to autoimmune diseases of all kinds. Number two, you can't absorb your minerals or your B vitamins without acid. So you're going to run into risks of osteoporosis, mineral deficiencies, B vitamin deficiencies. The B vitamins are important coenzymes for energy production, for heart health. So it can tumble out of control once you start suppressing acid via this issue with nutrient breakdown and digestion and assimilation. So number one, acid suppression is going to can lead to SIBO issues or bacterial issues. Number two, it can lead to nutritional deficiency issues, which can cause all kinds of other health problems. And you're not really taking care of the issue. All you're doing is suppressing the acid. Now, I remember when I graduated pharmacy school decades ago, the number one and number two best-selling drugs every year was Zantac and Tagamet. And I can remember counting out thousands of Zantac and Tagamet pills a day, not a week, not a month, a day. I would sometimes be counting out 5,000 to 10,000 of these pills. My average prescription was 100 or 120 pills, and I'd be filling 10 or 20 prescriptions a day for Tagamet and for Zantac, because every doctor knew that if you had a stomach ulcer, you were making too much stomach acid, and they would suppress your stomach acid so you wouldn't have your ulcers. Well, come to find out, it's not really too much stomach acid that causes stomach ulcers. It's actually bacteria that causes stomach ulcers. And that's why today they'll give you an antibiotic if you have stomach ulcer issues. So what is the real cause of GERD or reflux disease? It's a flaccid sphincter. You have a little valve that connects the esophagus to the stomach, and it's supposed to stay tight when there's food in the stomach. So the stomach can do its acid, it can bathe food in acid and do its mechanical crunching of whatever you ate. But when you have this condition of GERD, you have a flaccid or loose sphincter. It's called the lower esophageal sphincter, or the LES. And people who have this reflux issue have an LES problem. And there's several things that will make that LES flaccid or weak. Number one, the wrong kinds of foods will do it. Especially sugars and processed foods can cause a flaccid LES. Number two, cortisol, stress hormone, can cause a flaccid LES. And number three, SIBO and bacterial outgassings can result in not only a flaccid sphincter, but also in pushback via gases that are produced by bacteria. So if you are dealing with a reflux problem, first thing, watch out for problem foods. And that means doing a food diary and writing down everything you eat. And I always tell people to do a food diary because you want to know what your particular problem foods are. Everybody's got their own specific foods that are problems. And it could be something like as benign as eggplant or broccoli or avocados or oranges or apples. These are foods that contain compounds in them that can cause problems, not only digestive problems, but also immune problems, SIBO and immune issues. So do a food diary and notice when you have what you ate when you have symptoms. That means you write down the foods and then you write down the symptoms and see if you can start to see patterns. Oh my gosh, every time I have oatmeal or I have heartburn, every time I have cereal or every time I have eggs, whatever it is, you start to notice things. And this, by the way, for distributors, this is really important when we're trying to promote nutrition and promote the products, to vest our clients, our patients, our customers in their own health process. So this is what I do as a distributor. When you're working with a patient, if you have them do a food diary, they become vested. They become attached to their own healing process. And you always want your patient to be attached to their healing process. You don't want to be forcing them to do things and telling them what to do all the time. You want them to see how their lifestyle is impacting their disease process. So you want to vet when you have your patient doing a food diary, you vested them. They are now participating in their healing process, and then they can kind of see the relationship between their lifestyle and their choices and their diseases. And that's a very empowering thing to learn. When you start to see that, oh my God, this is not an accident. This is not some aberration that I have GERD. It's a response to every time I eat a certain food, or it's a response to my lifestyle. So always have people do a food diary and make that association. Eliminating problem foods is the first thing you want to do. Working on digestive health using the I-26, using the nightly essence and the FlorFX and the ultimate enzymes and the ultimate microbiome. That's another thing that you can do for GERD, for gastroesophageal reflux disease. Lowering cortisol as relaxing, not eating when you're under stress. You know, we've talked about this before, but I'll say it again. You have two nervous systems. The nervous system turns the outside world into the inside world. The nervous system turns the sights and the sounds and the smells and the tastes and the touches into our biochemistry. But you got two nervous systems. You got a nervous system that turns the information of danger into danger resolving biochemistry, and you got a nervous system that that turns safety signals into safety biochemistry. The emergency nervous system that controls emergency biochemistry that is triggered by seeing a lion or seeing a tiger or seeing a credit card bill or seeing your dysfunctional boss or whatever it is, in our world, which represents the lions and tigers, activates what's called the fight or flight response. And when the fight or flight response is activated, everything else is secondary. When you got to run from a tiger, all of the other symptoms in the body, all the other systems in the body that don't have anything to do with running away from that tiger shut down. For example, your immune system shuts down or is suppressed or inhibited when you're running from a tiger and you've activated the sympathetic nervous system. And when this fight or flight nervous system is activated chronically, you're going to get more colds. You're going to get cold sores. You're going to be more prone towards diseases that are the result of infections that you would otherwise be able to handle, including, by the way, viral infections. So when the fight or flight system is activated, your immune system becomes suppressed. When the fight or flight system is activated, you're going to have a problem conceiving a baby, because obviously you're not supposed to conceive a baby when you're running from a saber-toothed tiger. And that's why one of the main reasons why we have such an infertility epidemic. Many people know this. There's an infertility epidemic in this country and around the world, largely because we're all in fight or flight mode. When you're in fight or flight mode, your digestive system will become suppressed. That means you'll have problems with bowel movements, constipation. You'll have problems digesting your food, processing your food. That's one of the reasons why you don't want to watch the news while you're eating your lunch, or you don't want to be in a business meeting while you're eating your lunch. You don't want to have an argument with your spouse or your boss or your friend when you're eating dinner. This is why when you're eating, you want to be relaxed, because the relaxation nervous system is the parasympathetic nervous system, helps stimulate the secretion of digestive juices. The parasympathetic nervous system also has a tightening effect on the sphincter, the LES. So if you have GERD issues, relaxing while you're eating, activating the parasympathetic nervous system while you're eating, it can have a salubrious benefit for digestion, as well as for GERD, as well as for constipation, by the way. I got a kick when they wanted to have a COVID czar. I don't know if you remember this, when the COVID thing was happening, they wanted to have a COVID czar. I was thinking to myself, we don't need a COVID czar. We need a constipation czar, because we got a constipation epidemic in this country where everybody's freaking constipated, and everybody has sleeplessness issues and anxiety issues and immune issues. These are all manifestations of a hyperactive fight or flight system. So the parasympathetic nervous system should be active or should be superior or predominant when you're eating. And one of the best ways, by the way, to activate the parasympathetic nervous system is gratitude. Being grateful activates the parasympathetic nervous system. That's why we say grace when we eat. So instead of watching the news, be grateful for what you're eating, and your parasympathetic nervous system will be activated. And just as an aside, one of the signs of an overactive stress system, sympathetic nervous system, or fight or flight nervous system, is insomnia. We have a big insomnia problem, obviously everybody knows. Here's a little trick for you to fall asleep. If you know anybody who has insomnia, or if you have insomnia, you can take our Sleep Ease, which has GABA in it, and that's a wonderful way to help fall asleep. But you can also run down a list of 10 things you're grateful for while you're laying in bed. And then you go down the list again a second time. And then you go down the list a third time. By the time you go down the list the fourth time, you're going to wake up and it's going to be morning, and you will have had a nice 8-hour sleep. And it'll all be because you've told the sympathetic nervous system to stand down, and you've activated the relaxation nervous system through gratitude. So there's lots of ways to activate the parasympathetic nervous system for overall health, but specifically for the health of the digestive system, and specifically for this gentleman for GERD or reflux disease.
Yes. So Pharmacist Ben, we have to end this early so that we can get set up for the next part of today's schedule. Yes, you're all welcome to join. So we've got one quick little question here. So we'll ask Jill to unmute, but Jill, as you are unmuting, I just want to do a quick little shout out for those of you who are here with us right now and you'd like to stick around for our opportunity. Folks, build your dream, health, wealth, and purpose. So, Jill, Go ahead.
Hi. Hey, Pharmacist Ben. Everything that you said is perfect for my question. Like you've already said everything that I wanted to have on recording. But I have someone who's been taking Nexium for 30 years.
Oh my goodness.
And he has severe osteoporosis.
Well,
and she
no
knows
kidding.
Digestive system problems. I put her on probiotics, enzymes, and some things, and we're trying to work with her. But how do I get her off the Nexium? Like, how
Well,
do you recommend 30 years?
Yeah, first of all, she's going to have what's called a rebound condition when
She knows
she knows that, right? Yeah, so that's the problem, is she's going to have serious acid secretion once she gets off the Nexium. So food choices. First of all, all the things you're doing are great. I don't know if you said the ultimate microbiome. I would throw that in if you haven't said that. The nightly essence, ultimate enzymes, they're all very important. All the digestive support supplements. Have her do a food diary, because it's likely there's certain foods that are causing problems, and she's going to have to start eliminating those foods. Eating less food is also very important. Less food means less secretion of acid. So, this is, I don't know if you can see this. This is your stomach. That's the size of your stomach. How much food is that? That ain't a lot of food, right? That's like not even a quarter of a plate full of food, right? So eating less food is very important. And believe it or not, you only need about 1,000 calories a day. I mean, that might sound crazy, but you don't need a lot of calories. You need much less calories than we think we need. The average American gets over 3,000 calories a day. We only need about 1,000. So eating less food and watching out for problem foods is probably the most important thing she could do. Intermittent fasting can definitely help her. And then all of the digestive support, and then looking for the specific foods that are causing the problem. And usually it's going to be the foods that we know we shouldn't be eating: the processed foods, the breads, the cereals, sweets. Those are usually the problems.
So I wanted her to go off at day 4 of the Nexium, but she's resistant on doing that.
Well, look, Jill, you don't want to. If people are resistant, they're resistant.
Well, she wants to do it though. She does want to do it. She's just afraid. And
well, yeah, that's understandable, because GERD reflux is horrible, and I can imagine that she'd be afraid. But assure her that there's a relationship to the foods she's eating, and once she starts controlling the foods, that won't happen. And even if she has to fast for a day or so first, she'll notice that when she fasts for a day, that she's very unlikely to have a reflux problem. Now, if it's really severe, she may still have it, but there won't be any acid in her stomach. So, if there's no food acid is secreted in response to food.
So she just has to muscle it out, is what you're.
Well, by eating less food and by making better food choices in combination with the supplements you're talking about, there'll be a lot less likelihood for reflux. And I can understand her fear, like I say, because it is a miserable feeling to have that stuff splash back up into your throat. But assure her, number one, she knows she has osteoporosis. She really doesn't have a choice. And if she has osteoporosis, by the way, that's what she sees. But she doesn't see the connective tissue deteriorating in her fascia, in her organ, in the collagen that wraps around all of her organs. She doesn't see the connective deterioration that's occurring in her heart. The heart sits on a scaffolding of connective tissue, so that's deteriorating too. Connective tissue is deteriorating all over her body. She's seeing it in the bones, but it's deteriorating in the blood vessels and in the heart and in the fascia and in her skin and wherever else she has connective tissue. So it's much more serious than just osteoporosis. You may want to reinforce that for her.
You just did. Thank you.
Oh, she's on here on the call?
No, okay, but I'm going to share it. I'm going to share it.
Okay, good. Thank you, Jill.
Thank you. Thank you.
All right. Well, thank you so much, Jill. And thank you, Pharmacist Ben, for another great question and answer time, where we look deeper into the products, the causes of why we're all messed up. So folks, hang tight. And if you are not in with us right now and you would like to join us, make sure that you go to zoom.dailywithdoc.com and you can join us for our opportunity section of today's programming. My name's Becca Dukes, and we are excited to have you here with us and look forward to brighter and greater futures as we work together.
Thank you, everybody. Bye. Bye, Doc.
Bye, Doc.